Hi everyone, my name is Stephanie Dowden. I'm a Paediatric Nurse Practitioner and I am based in Perth in Western Australia. I've been a paediatric nurse my entire career and have worked in a range of children's hospitals in Melbourne, in London and in Perth, and now I've been working in the community setting for about 7 years in my own practice in a business that's called NursePrac Australia. So my innovation is really my business, and NursePrac Australia started because I had qualified as a nurse practitioner and couldn't get a job. So in my wisdom, I thought maybe I should start my own business. So the original idea was to set up a community health model, trying to work out the gap maybe between a GP and a paediatrician. If you have extra money, you can go and see someone privately, but if you don't, you get referred to a paediatrician or a hospital wait list, and you can wait a very long time to be seen. Basically, the families that need the services the most often disengage quite early from them. So when things get more complicated, they don't have a connection in their community to go to for help. So probably the turning point for why the model got changed a bit was I was asked to do a clinic at a primary school in an area that had a lot of social disadvantage. So when I went in there and started working with that school and having a look at children, I realised a lot of the behavioural issues were due to high levels of social inequality and financial disadvantage, and having parents with a lot of difficult things in their lives. What was really striking about these families was how powerless they felt, how they didn't feel they had a voice, they didn't know who to talk to, they didn't understand the health system, they didn't understand the child development system, so they felt like they were drowning in their role as parents and their children were being left behind. They had so many competing difficulties in their life. Going to an appointment was not a high priority. Paying the rent was a high priority. Paying bills was a priority. Getting food on the table was a priority. But some things like going to an appointment with someone they'd never met before that they felt awkward about going to see because they didn't really know what to say, that got pushed aside. For me, as a nurse practitioner who's worked very hard to advocate for the role of nurse practitioners over the last 10 or so years since I've become a nurse practitioner, it's really exciting to be recognised at this level and also to see other nurse practitioners who've been trailblazers in the past. For me, what the Nursing Trailblazer Award brings is a bigger vision of what nurses and midwives do. I'm really proud of what our clinic has achieved in the last 7 years, and I've had an amazing little team I work with. There should be lots of clinics like ours, and they should be funded also in the public health system, so many families get this level of advanced clinical nursing practice for their children and for themselves. I would like to advise any nurses who would like to be more trailblazers or to be trailblazing and delivering better models of care to not forget that many nurses have amazing ideas but may not have a voice or may not have an environment they work in where they can try out new models and new ideas. But those of you who do or have a supportive manager and you want to try something different, go for it, because it's those innovative nurses that make massive changes in health.